Hi, I'm Terry Nava Anderson. I'm the Director of Certification at Dona International. I'd like to take a moment to walk you through our Birth Doula Certification Application Packet. This is a new packet coming out April 15th, 2023. So if you're in a workshop after April 15th, this packet will be included in your manual so you can follow along with this overview. So let's begin. The first thing in the requirements for certification are to have attended a DONA approved birth doula workshop. These are available in person, they're available virtually, as well as in hybrid format, meaning they are partially virtual and partially in person. The workshop is valid for 3 years. This means that you have 3 years from the completion date, the last day of your workshop, to finish up your packet and send it in. I'd encourage you to start a packet folder now. And the very first item to go into your packet folder is your workshop certificate of completion. You don't have to finish everything in the order that I present it in this overview, but you do need to sort the materials in this order, as you will see throughout the presentation. If you've taken your workshop after April 15th, you'll probably have already registered your packet during your workshop. If you haven't done that yet, go to dona.org and create a login, then go to the boutique and find the packet registration information. Enter the name of your trainer and the dates of your workshop. Without that information, you will not be able to purchase the certification application fee when you're ready to apply. The next item to go in your packet folder is your receipt for membership in Dona International. You need to be a current and active member in the organization in order to turn in your packet, but we encourage you to become a member right out of your workshop. If you've just finished your workshop, you're eligible to use the coupon code for 30% off your first year. The next item to go in your packet folder is proof of completion of a childbirth education course. There's several ways to complete this requirement. If you're already a certified childbirth educator, licensed or certified midwife, or licensed or registered labor and delivery nurse, there is no additional childbirth education requirement. Simply submit your proof of credential. For everyone else, there's two options. One is to take an introduction to childbirth class with a DONA approved trainer. Many trainers offer this as part of their birth doula workshop. So check and see if that was included. It will be at least 7 hours, but sometimes longer, and include some required topics. If that wasn't an option for you, you could seek a childbirth educator in your area. It can be taught towards parents, but it needs to be at least 8 hours of instruction and include the required topics. You'll put your certificate of completion for these courses in your folder. And if you went for the option 2, you'll need your childbirth educator to sign a form that you'll find in your packet. So those required topics, if you're doing option 2, the class has to include anatomy and physiology of the perinatal period, including lactation and pregnancy warning signs, physiologic versus medical models of birth, and include the various types of providers and birth facilities that might be options for your clients. It should include common clinical procedures and perinatal tests and the benefits and risks and rationale for those. It should include an intro to patient rights and informed consent and informed refusal. It should also cover birth challenges and complications and have an introduction to basic comfort measures, relaxation techniques, breathing patterns, and bearing down techniques and pushing, as well as talking about pain management, the gate pain theory, pain medications and anesthesia, and their administration and effects, as well as normal newborn appearance and procedure, and an introduction to the benefits of lactation and human milk, as well as an intro to birth equity. You see that this has a star here. You might not find this in every childbirth course in your area. If it wasn't included in your course, you could go to elevate.dona.org and find the Racial Equity and Inequity webinar. This is a free webinar, and it will count towards your requirement for this part of childbirth education. The next part of the coursework is to complete a lactation education course. If you're already a credentialed lactation support professional, there's no additional lactation education required. If you're not, you have two options again, just as before. You might get the Basics of Lactation Support class with a DONA approved trainer. Many include this with their workshop. It will be at least 3 hours. Or you could take a lactation support class that's taught specifically for perinatal professionals by a credentialed lactation educator. This is different than the childbirth ed. Here, this lactation course isn't one just for parents. It needs to be specifically towards perinatal professionals. You'll include in your packet folder either your proof of credential or the certificate of completion, and if doing option 2, the signed form from your instructor. If doing option 2 for lactation ed, it needs to include the benefits of human milk, basic anatomy and physiology, baby's contribution and readiness to nurse, their signs of hunger, and their signs of fullness. Should include proper latching techniques and how to know when a baby is suckling effectively and getting good milk transfer. Should include nursing positions and holds, and early nursing challenges that many people experience, as well as knowing when to refer to a lactation professional. As I said, it needs to be taught by a credentialed instructor. The instructor has to have at least a 45-hour course or longer and be then a CLE or a CLEC, CBS, IBCLC. That stands for Certified Lactation Educator, Certification Lactation Educator Counselor, Certified Breastfeeding Specialist, and Internationally Board Certified Lactation Consultant, just to name a few of the various credentialing that you might encounter for lactation support professionals. They then need to complete a lactation education class attendance verification form for you. Next up is the required reading. The first 2 of these should be easy because they're covered in all of the workshops. So you've probably already read the Standards of Practice and Code of Ethics. In your application, on the application page at the end of the packet, you'll be asked whether or not you agree to abide by the Standard of Practice and Code of Ethics, and you'll check that box. If you don't agree, you will not receive certification. So I encourage you to read those thoroughly and make sure that you agree. You'll also be reading the position papers from DONA International, one on the birth doula's role in perinatal care and the other in the postpartum doula's role in perinatal care. You'll just put a check mark on the application that you read those. For the books that are part of the required reading, there's the requirement to write and then submit 3 to 5 sentences of your key takeaways from this book. How do you plan to use it? What was the most interesting component of it? You'll do that for the birth partner, which many of you have probably already read either all or parts of prior to your workshop. And then you'll be choosing 3 books, one from Group A, one from Group B, and one from Group C. Group A has all of the perinatal periods of pregnancy, childbirth, the immediate postpartum, and newborn care. You have 3 choices there from Group A. You'll pick one of those and then write 3 to 5 sentences on your key takeaways. Group B is the diversity category. There are 6 books in that category. You'll choose one. Group C, you have the option to choose something that's not on the list that we provide. If you do choose to do that, you'll need to provide your 3 to 5 sentence takeaways, as well as a discussion of whether or not this book aligns with the DONA International Standard of Practice and Code of Ethics. So here's Group C. We have a large variety of books. You'll choose one book from a category there you're interested in. You have choices of books about birth planning, business, doula history, perinatal history, cultural awareness and systemic racism, lactation, postpartum, and difficult or traumatic births. I'm happy to say that in all groups, A, B, and C, there's 93% of the books on the list are available as ebooks, electronic books in a variety of formats. And at least one book in every category and subcategory is available as an audiobook. After you've done all the coursework and reading, you might want to then finish your self-assessment questionnaire. You'll have 10 questions and their short answer based on what you have learned in your workshop and read in the reading materials. You'll put your answer sheet in your packet as item number 6. The next packet folder item is your community resource and reference list. This is a list you want to compile for your clients of the people and places that you recommend in your area. You can put it on a spreadsheet or make a bullet point list. If it's on a spreadsheet, make sure that when it's printed, it is legible. Sometimes they get really small. On your resource list, you are going to have 10 categories and at least one resource in each category, but you need 25 resources total. Your categories are addiction, abuse, and harm reduction. That's one category. Alternative and complementary care. That's where you might put acupuncturists, chiropractors, herbalists, things like that. Then child and family advocacy and welfare resources. Then childbirth education and outcome-specific support groups. So like VBAC support groups, twins support groups. The next category is domestic violence support groups and resources. And then lactation professionals and support groups, parenting support groups and education, perinatal and pediatric health care. That's where you'd put your OBs and your midwives and your pediatricians. Perinatal mood and anxiety disorder resources, and then postpartum doulas. The last parts of your application are for your qualifying births. So you'll need to attend and document 3 qualifying birth support experiences. There are some requirements for those experiences. First, they have to have occurred after you've taken your birth doula workshop. And then for each client, you must provide continuous support that begins before or at the onset of active labor and continue through at least 30 minutes postpartum. This one is a tricky one sometimes. Sometimes you need to just make an educated guess about whether or not your client's in active labor if they're not getting cervical exams. So hopefully you've learned in the course of your workshop and your readings how to assess the onset of active labor. What are you looking for? Contraction pattern, mood changes, know all of those things and document how you knew it was active labor when you arrived if they weren't having an exam. And this needs to continue until delivery and then the immediate postpartum. So if your client gets an epidural and you choose to take that time to go home and nap during active labor, that's a birth that will not qualify as a support experience. So be mindful of pacing yourself, making sure that you're arriving at the right time so that you don't have to leave when someone is in active labor. There's an FAQ, a frequently asked questions section portion of this packet document that's in your manual, and read through that. It talks more about why it's important to provide continuous support in active labor. The sum total of your 3 births needs to be at least 15 hours, of which only 30 minutes per birth postpartum counts. So an hour and a half total of that immediate postpartum and 13.5 hours of continuous labor support. Many of you will find that you will achieve this number with just 1 birth. That's okay. You still need the other 2 births. If you are attending births that are very fast, what we call precipitous births, and you don't arrive until your client is 8 centimeters dilated, this birth will not count. Precipitous births can count. We just have to get there really early, making sure that you're there by the onset of active labor. Only 1 virtual support experience can be used for a qualifying birth, and that is all or part. So if any part of your active labor support is done virtually, this one counts as your virtual support experience. The birth support experiences are not limited by outcome. So you can attend 3 vaginal births, you can attend 2 vaginal births and a cesarean. You can attend 3 cesareans as long as only one of those births was planned, scheduled cesarean. When a labor starts on its own and ends in cesarean, we call that an intrapartum cesarean. And you can have 3 intrapartum cesareans as your qualifying birth experiences. For those birth experiences, as I said, you'll need to provide continuous support from the onset of active labor. Scheduled cesareans are a little bit different. You need to provide support before the scheduled cesarean, and then in the immediate postpartum. You don't need to be in the operating room for any cesarean, whether scheduled or intrapartum, but you do need to provide that immediate postpartum support for it to be a qualifying birth experience. So then the question is, how do you document the birth support experiences? You will need some forms filled out by your clients and others that are there, as well as yourself. So in your packet folder, when you put these documents in there, you want to make sure that you've sorted them by client. So for each client, you'll need a client confidentiality release. You should get that signed before you've taken any notes on your client. Have that signed in the prenatal period, unless you're meeting your client in labor for the very first time. But before you take any notes on them, have that client confidentiality release signed. And then after the support experience, you'll have your client fill out the evaluation of your support. You'll also need an evaluation of support from someone else who was there as an observer. That could be healthcare staff. That's actually the priority. Try to get healthcare staff to fill this out, whether that's a doctor, nurse, or a midwife. Sometimes they're not able to or are unwilling to. In those cases, you can have the client's friend or family who was present fill that out. And then there will be birth record sheets filled out by you. And so you'll compile all of these. All of client 1s go together, all of client 2s go together, all of client 3s go together. So let's look at what those record sheets include. There's a short client history, a short summary of your support, and then your notes and observations of various parts of the prenatal work and the birth and the postpartum work. If you are meeting your client for the first time and only time during labor, like you work at a hospital or somewhere where you don't know who you're going to be supporting, it's okay if you don't have the prenatal contact, the pre-labor contact, or the postpartum contact parts. But if you did work with your client for those periods of time, please do include your notes and observations about those individual periods of time. You'll also need to talk about your client's emotions throughout the process, your own interactions with the team, and your lessons learned in this process. Each and every birth, you're going to learn something new. I've been a doula for over 15 years. I've been at almost 600 births now, and each and every time there's a lesson learned. Your final steps to completing your packet are to then go back to dona.org, go into the boutique, and pay the certification application fee. You'll include that receipt as item number 11. You'll fill out your application form, item number 12 in the packet. Compile all your documents. You can either compile them into a single PDF using an app or a program to do that. Adobe has one online that you can use. There's lots of things that you can download to your phone, take a picture of your documents and do it that way. So compiling a single PDF that's then sent off, or you can send it old school as paper, send it to the office, and instructions for that will be on the receipt you get after you pay your certification application fee. That will come to you as an email. Check your spam if you don't see it in your inbox. And you submit your application according to those instructions and go celebrate yourself. Congratulations, you've done it.